ions. So if you don't have the mucus or bicarbonate ions, your gastric acid can attack your own epithelial cells and surrounding cells and tissues. So that's when we get that ulcer. Why? Because all these cells are being digested by your own stomach acid. And again, we did cover those peptic ulcers, very nasty, very sore looking, very red and inflamed. So we did cover Helicobacter pylori last lesson. So again, remember, bacteria can cause ulcers, but there are actually many ulcer causes. We did cover stress as well. So NSAIDs, those non-steroidal anti-inflammatory drugs. So non-steroidal, remember those 3 hexagons and a pentagon? That's a cholesterol backbone. So things like cortisol, hydrocortisone, those are anti-inflammatory, but they're steroids. These drugs are not like cortisol. Why? Because they're not steroids. They don't have that 4-ring backbone. So things like aspirin, ibuprofen, naproxen, these are all NSAIDs because why? They're anti-inflammatory, but they're non-steroidal. So these NSAIDs, so why do they sometimes have gastric effects? So as you might say, like if you have ulcers, your doctor might say, hey, lay off on these ibuprofen, aspirins, and whatnot, because why do they tell you to do that? Well, it all involves prostaglandins. And again, prostaglandins are those eicosanoids, those signaling molecules that your book says are hormones, but they act more in a local fashion than, again, remember, hormones can potentially travel anywhere in your body or throughout your, or more specifically, your circulatory system, whereas prostaglandins, they're more of a local thing. So prostaglandins cause inflammation. So this is, again, why you might want to take an NSAID. You want to reduce prostaglandins so you reduce the symptoms of inflammation. But the thing about prostaglandins, it doesn't just involve inflammation. Prostaglandins also increase gastric mucus secretion. So prostaglandins cause inflammation and then all that pain and redness, but they're also important for making that mucus. So the thing is that prostaglandins also decrease gastric acid production. So they're actually protective in your digestive system. They're going to cause more mucus to be produced, and they're also going to make your stomach acid less acidic. So you have less ill effects from gastric acids, or less potential of gastric acid from digesting your own gastric epithelium. So then there's this enzyme, again, the ASE, dead giveaway cyclooxygenase, or COX, COX for short. This is an enzyme, but what does it do specifically? Well, these are the enzymes that make prostaglandins. So what do you think, how do you think this is related to NSAIDs? So NSAIDs are COX inhibitors. So they inhibit this enzyme. So things like aspirin, it inhibits COX, the cyclooxygenase. So if you have aspirin, if you inhibit the enzyme that makes prostaglandins, what happens to your levels of prostaglandins? It's going to cause them to decrease. So if you have decreased prostaglandins due to an NSAID, being you taking some NSAID, it's going to decrease inflammation instead of causing inflammation. Again, this is why you're taking this anti-inflammatory drug. You want to reduce the symptoms and pain and swelling and redness and fever that comes with inflammation. But the thing is that instead of increasing your gastric mucus, now you have less of that protective gastric mucus. So you have less of the protective barrier in your stomach. But what happens here? It increases the gastric acid. So now you have less protection. Now your stomach acids become very acidic. So now you have less protection and more acidic. So what do you think this does to your risk of ulcers? Less protection, more acid? Well, yeah, add that aspirin there, less mucus. Why? Because again, NSAIDs inhibit cyclooxygenase. That reduces the amount of prostaglandins. Prostaglandins are what you need, or actually increase mucus secretion. So if you inhibit it, that's going to decrease mucus production. And it's also going to make gastric acid even more acidic. So this is why things like aspirin, ibuprofen, this is why they tend to cause ulcers if you abuse them or take a very high dose. Why? Because again, all due to inhibiting cyclooxygenase and drastically reducing your prostaglandin production in the stomach. The coworker just pops aspirin like candy, and he's like, oh, I always have these ulcers. I'm like, lay off the freaking aspirin. Why? Because again, all due to this cyclooxygenase and prostaglandins. So you might have seen this drug, or your parents or grandparents might take this drug, Prilosec, or the generic name is Omeprazole. So this treats peptic ulcers and gastroesophageal reflux disease, and it's a proton pump inhibitor. Sound familiar, right? So Prilosec, what does that do? All the way down to that parietal cell. Remember the parietal cell generating that, this is where you get the hydrochloric acid from. So remember, carbonic anhydrase combining carbon dioxide and water to form a bunch of carbonic acid. Carbonic acid dissociates into protons and bicarbonate. So then what do you have here? That proton pump, remember that proton pump is what actually moves the protons from the inside of the parietal cell to the insides of your stomach. So again, Prilosec, Omeprazole, that's a proton pump inhibitor. So instead of allowing this to happen, it's going to block it. So if you have Omeprazole, now we have blocking of the proton pump. Can these protons actually move into the gastric gland? Nope. So again, if you inhibit those proton pumps, you can't move these protons into the insides of your stomach. So what does that do to your gastric acid and your insides of your stomach? Well, it's going to decrease acidity. Why? Again, you can't move the acid from the parietal cells to the inside of your stomach. All right, so again, gastric acid, again, if you want to prevent those ulcers, maybe you want to take Prilosec. So take Prilosec, what does that do? Takes protons out of the equation, less acid, less protons, less acidic in the gastric acid. So now you have a reduced chance of ulcers by lowering the pH. I'm not lowering pH. Ooh, being a rookie mistake. So by raising the pH and lowering the proton concentrations in your gastric acid.